So now we look at the social safety net that is available for different communities in countries around the world. This module is based on the World Social Protection Report by ILO, which looks at the period from 2017 to 2019. So social protection, as far as ILO is concerned, they think it's a human right, and they include child and family benefits, maternal protection, unemployment support, unemployment injury benefits, old age benefits, disability benefits. All these are included in the social protection. So all these areas come under the social development goals that were passed or approved by the world leaders in 2015. The SDG 1.3 commits countries to implement nationally appropriate social protection systems for all. So these are the things which the world leaders, the countries, the governments should work on. As we see in this slide, that the achievement of countries is very limited. So if we look at the pie chart, only 45% of the global population is effectively covered by at least one social protection benefit. So according to ILO, there are 5 different social protection benefits, which is child and family benefits, maternity benefits, unemployment benefits, disability benefits, and old age pensions. So according to ILO, only 45% of the population has one of the 5 benefits, and only 25% have the full range of benefits. So if we look at the benefits or the social protection, it means that 70% or 71% of the population doesn't have full protection. And the continent which is most affected or where least social protection is available is Africa, and after that it's Asia, and the best one is Europe and Central Asia. Americas fall in between. As far as child and family benefits are concerned, 35% or 1.5 children remain uncovered. Maternity benefits, only 41%. Less than half of the mothers have these benefits. Unemployment benefits, 1 in 4. Disability benefits, less than 1 in 3. And old age pensions, 2/3. So 1/3 don't have these pensions. Then there is the division between the rural areas and the urban areas, and 56% of the global rural population lacks health coverage as compared to 22% of the urban areas. So there is almost more than 30% of gap based on where one is located or residing. If you look at this slide, which tells you how different regions of the world compare as compared to different types of social protection is concerned. So if you look at the older persons, as far as world is concerned, 68% have benefits. But in Africa, only 30% have these benefits. In case of Americas, 86% have these benefits. And in case of Asia and Pacific, 55% have these benefits. But Europe and Central Asia, almost everyone, 95% have these benefits. So similarly, if you look at these different areas, you can see and compare that which region is doing better and which region is not doing good. So Africa and South Asia, or Asia and Pacific, are 2 areas which have not done well as far as social protection in different areas is concerned. So if you look at the social protection for children, only 35% of the world children have this protection. There's wide regional disparities, as we have seen in the last slide. 1.3 billion are not covered, and they mostly live in Asia and Africa. If we look at the elderly, the situation is much better. 68% receive benefits. But these benefits, we don't know whether they are high or low, appropriate. So mostly these benefits are very low, and older elderly person cannot live above poverty line because of these benefits. So there is a need to increase these benefits even where they are available. Universal pension, new countries developing countries have started providing universal pension coverage to elderly people. So you have looked at Pakistan has also passed, federal and provincial governments have passed different laws to help the older persons, but their effectiveness is yet to be seen. Austerity has forced many countries in the developing world to decrease social protection for the elderly, for the children, and for other areas. So as you look in the last 1 or 2 years, Pakistan has also decreased many health benefits and many education benefits, for example, scholarships for the poor people, because of austerity, because of the IMF program which we are going through. So social protection for working age, and this is linked to unemployment, injury, pregnancy. Only 41% of the new mothers have this benefit. 22% receive unemployment benefits. So around 80% when they are unemployed, they have to look for, or they survive on their own savings, or they have to look, they have to ask their friends and families. Government will not provide them anything. Only 28% of the severely disabled get benefits. So this is one area again where Pakistan and Asia and Africa are lying behind. Most of the disabled and severely disabled are not provided anything. So families have to bear all kinds of expenditures related to their health, related to their survival. So around the world, 3.2% of GDP is spent on public social protection. And then there is, of course, disparity in terms of coverage and advocacy gaps. Social protection, of course, changes lives and changes countries. So if we provide benefits to the people, they will be more economically proficient. They will contribute to the economic growth of the country. So waiting for the fiscal space to help the elderly, to help children, to help women is not going to help. So this is the graph which shows that if you spend money, things will change. So if a skilled birth attendant or skilled health professional is available, the maternal mortality rate will decrease. So there is no difficult science about it. So if you look at the graph, when you increase the presence of skilled health personnel, the mortality rate will decrease. Because Pakistan and other developing countries are not spending on these areas, they are suffering.